Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Mrs. Lucy. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Lucy. It's good to see you today. How are you feeling?
Hi, Doctor. I'm feeling a bit better, but my leg is still stinging quite a bit from the jellyfish sting I got this morning. I wasn't sure if I should come in, but the pain is more than I expected.
I see. Jellyfish stings can be quite painful, and the severity can depend on the type of jellyfish. Can you tell me more about what happened?
Sure. I was swimming at the beach with my kids, and suddenly I felt a sharp sting on my calf. It was like being burned, and when I looked down, I saw part of the jellyfish still on my leg. I quickly brushed it off, but it was already pretty painful. I went to a lifeguard who rinsed it with water and put vinegar on it. The pain subsided a little, but it's still pretty bad.
That was the right thing to do. Vinegar helps neutralize the toxins from the sting, but since the pain is persistent, it's a good idea that you came in. Have you noticed any other symptoms besides the pain, like swelling, difficulty breathing, or a rash spreading beyond the sting site?
There's some swelling around the sting, but no trouble breathing. I just feel a bit nauseous and lightheaded.
Nausea and lightheadedness can sometimes happen after a jellyfish sting, particularly if the body is reacting to the venom. While most jellyfish stings are localized and cause only pain, in rare cases, more severe reactions can occur. Let's take a look at the affected area. You've got some localized swelling and redness, which is typical. It seems like a mild reaction, but we'll monitor it closely to ensure it doesn't escalate. I don't see any remnants of the tentacle, which is good. Sometimes small pieces of the jellyfish's tentacles can stay on the skin, continuing to release venom. So it's important to remove them as quickly and carefully as possible.
Oh, I didn't realize they could keep stinging you like that. What should I have done differently?
The key thing is not to rub the sting site, as that can cause the venom to spread. Using seawater to rinse the area is best. Never use fresh water, as it can cause the nematocysts, which are the stinging cells, to release more venom. After that, applying vinegar like the lifeguard did is an effective way to neutralize the sting. If vinegar isn't available, a baking soda paste can also help.
Okay. I'll remember that for next time. Hopefully, there won't be a next time though.
Let's hope not. But it's always good to be prepared. Now, in terms of treatment, since the pain and swelling are persisting, we'll go ahead and apply a topical corticosteroid to reduce the inflammation. And I'll prescribe an oral antihistamine to help with the itching and swelling. It should also help ease your nausea. In more severe cases, we might use a stronger pain reliever or even a muscle relaxant if there are spasms.
That sounds good. Is there anything else I need to watch out for?
Yes, over the next 24 hours, monitor for any signs of an allergic reaction or worsening symptoms, things like increased swelling, trouble breathing, or dizziness. If that happens, you should come back immediately or go to the emergency room. Also, try to keep the area clean and avoid scratching or irritating it.
Okay, I'll keep an eye on it. Is this something I should be worried about long term?
In most cases, jellyfish stings resolve within a few days to a week. The symptoms you're experiencing should subside as the venom breaks down in your system. You might have some residual itching or minor swelling, but that should fade with time. Very rarely, some people develop long-term sensitivity at the sting site, but it's not common.
That's reassuring. I just didn't expect it to hurt so much. I've heard jellyfish stings can be dangerous though.
That's true. Certain species like box jellyfish or Portuguese man-o'-war can be quite dangerous and even life-threatening in some cases. However, most stings, especially from jellyfish found along recreational beaches, are painful but not life-threatening. It's always important to get checked out if you're unsure or if symptoms persist, like you did today.
I'm glad I came in. The pain was definitely more than I expected, and I didn't want to take any chances.
You did the right thing. Now, I'll go ahead and get you started on the treatment, and you should begin to feel better soon. If the pain doesn't improve or gets worse, let us know right away.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Mr. Dawson. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, Mr. Alex Dawson, I see from the notes that you've recently returned from a trip to West Africa and have been experiencing some symptoms. Could you tell me more about what you've been feeling?
Yes, I got back about 2 weeks ago. At first I was just tired, which I thought was normal from the trip. But a few days later, I started getting really bad headaches, and then I had this fever that comes and goes. I also feel like I can't stop sweating at night, and my muscles are just aching all over.
That sounds concerning, especially since you've recently traveled to a malaria endemic area. Have you noticed any other symptoms like chills, nausea, or diarrhea?
Yes, I've had chills, and I feel cold one minute, then I'm burning up the next. I haven't had much nausea, but I've been really weak, and I just don't have an appetite.
I see. Malaria is definitely a possibility given your travel history and symptoms. Did you take any malaria prophylaxis before or during your trip?
I did, yes. I started the medication 2 days before leaving and continued for a week after I got back. But I guess I could still get malaria.
Yes, while malaria prophylaxis significantly reduces the risk, it doesn't guarantee complete protection. It's possible to contract malaria despite taking the medication, especially if it's a strain that might be resistant to the drugs you were using. Based on your symptoms, intermittent fever, chills, muscle aches, and fatigue, it's important that we test for malaria to confirm whether that's what's causing your symptoms.
What kind of test is that?
We'll perform a blood test called a malaria parasite test, or sometimes it's referred to as a blood smear test. This test will check for the presence of the malaria parasites in your blood. I'll order that immediately. The results typically come back within 24 hours.
And if it is malaria, what happens next?
If the test confirms malaria, we'll need to determine which species of malaria you've contracted. There are 5 species that can infect humans, and treatment depends on which one it is, as well as the severity of your symptoms. Most commonly, the treatment involves a course of anti-malarial drugs such as artemisinin-based combination therapy ACT or chloroquine, depending on the strain. We'll also assess whether you need hospitalization, though many cases are treated successfully as outpatients if caught early.
I've heard malaria can be really serious. Should I be worried?
Malaria can become serious if left untreated, especially with species like Plasmodium falciparum, which can cause severe complications like organ failure or coma. However, since you've sought medical attention early, your prognosis is much better. We'll keep a close watch on your condition and treat it appropriately once we have the test results. The most important thing is that you're here now, and we can start taking action.
Okay, that's a relief to hear. Is there anything I can do in the meantime while waiting for the test results?
For now, it's essential to stay hydrated, as fever and sweating can cause dehydration. Rest as much as possible, and if the fever spikes or your symptoms worsen, don't hesitate to call or come in. You can also take paracetamol to manage the fever and muscle aches, but avoid ibuprofen or aspirin for now, as they could cause complications if malaria is confirmed.
Got it. I've been pretty exhausted, so I'll make sure to rest and drink more water.
That's a good plan. Once we have the test results, we'll know more about what we're dealing with and how to proceed with treatment. If it's not malaria, we'll look into other potential causes, such as a viral infection or another tropical disease.
All right. Thanks, doctor. I'll wait for the results and keep an eye on the symptoms.
You're welcome, Alex. We'll be in touch as soon as the results come in. Take care, and don't hesitate to reach out if you feel worse before then.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse explaining about managing common symptoms. Now read the question.
Over the next 48 hours, I will have a series of meetings with you to explain how to manage common symptoms your loved one may experience at home. We will review options for addressing nausea, shortness of breath, fatigue, and other discomforts that may arise. The hospice team, which includes the physician, nursing staff, social worker, and chaplain, will also be part of these discussions to provide guidance and support. The first meeting will cover medication options and non-medication strategies to relieve nausea and shortness of breath. In the second meeting, we will discuss managing fatigue and how to help your loved one conserve energy and stay comfortable. Following that, we will have a meeting to review other symptoms that may develop, such as pain or anxiety, and ways to control them. In the final meeting, we will focus on monitoring your loved one's condition and knowing when to seek additional support from the hospice team. You will have opportunities to ask questions at each session, and we will work together to ensure that your loved one's symptoms are managed effectively.
Now look at question 26. You hear a physician discussing about a patient's pain. Now read the question.
Sounds like muscle spasms in your abdomen. Have you been feeling any changes in your bowel movements?
Yeah, it's been irregular, and sometimes I feel bloated too.
That could indicate a condition like irritable bowel syndrome or functional dyspepsia. I'm going to prescribe an antispasmodic medication to help relax the muscles in your gastrointestinal tract. This should provide relief from the cramps.
Will it help with the pain as well?
Yes, by easing the spasms, it should reduce the pain. I'll also recommend some dietary changes to help manage the symptoms. Let's see how this medication works for you first.
Now look at question 27. You hear a conversation between a patient and a dietitian. Now read the question.
Yes, I was diagnosed with lactose intolerance 2 months ago. So I've been trying to avoid dairy on my own, but it's been a bit challenging. That's why I'm here today.
I see. So, your diagnosis means your body has difficulty digesting lactose, which is found in milk and other dairy products. So, what changes have you made to your diet so far?
Well, not many, to be honest. I've started using lactose-free milk, but I haven't really been successful in finding other alternatives for things like cheese and yogurt.
Okay, I'm going to recommend that you...
Now look at question 28. You hear Mr. Raj explaining progress with electronic health records. Now read the question.
Now, let's turn to Raj, who's going to share some insights into our progress with electronic health records. Raj?
Thanks. So, when we compare our implementation of EHR systems with other hospitals in similar resource-limited settings, we're actually seeing better than expected adoption rates. That's a positive sign, especially considering the usual constraints in infrastructure and technical support. However, where we are facing challenges is with the system's downtime and connectivity issues. These interruptions are causing significant delays in patient care and data access, which, as you all know, can be particularly disruptive in an emergency setting. To address this, our IT department is working on optimizing the system to ensure more stable operations and exploring potential local backups during outages. This is a priority given the critical nature of health data and patient management in these settings.
Now look at question 29. You hear an intern asking a senior colleague about a patient's recovery from chemotherapy. Now read the question. I've noticed that Mrs. Patel has been feeling extremely fatigued after her last round of chemotherapy. I know fatigue is a common side effect, but is there anything we can recommend to help her manage it better?
You're right, post-chemotherapy fatigue is quite common. It can linger for some time as the body recovers from treatment. One of the best ways to combat this fatigue is to encourage patients to engage in light physical activity, such as short walks or simple stretching exercises. This can actually boost their energy levels over time by improving circulation and oxygen flow. The nursing staff has already been helping Mrs. Patel with some light stretching and breathing exercises. It's important that she starts with these low-impact activities before gradually increasing her activity level. Over time, this should help her feel less fatigued and improve her overall recovery.
Now look at question 30. You hear a patient asking an oncologist. Now read the question.
During chemotherapy. I've heard that people can either lose or gain weight. Is that something I should be worried about?
Yes, it's common for people to experience weight changes during chemotherapy. Some patients lose weight due to a loss of appetite or nausea, while others may gain weight due to changes in metabolism or steroids used to manage side effects. It's important to monitor your weight closely.
What do you usually recommend to patients going through chemo in terms of maintaining a healthy weight? Should I focus more on eating to avoid losing weight, or should I be careful about not gaining too much?
It's essential to find a balance. The key is maintaining a nutritious diet that supports your body's needs while undergoing treatment. You want to avoid both excessive weight gain and unintentional weight loss. Prioritize nutrient-dense foods that provide energy and help your body heal, and stay mindful of changes to your appetite or eating habits.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a specialist in bioethics called Dr. Sarah Whitfield giving a presentation on the ethical implications of genetic testing. You now have 90 seconds to read questions.
Hello everyone, I'm Dr. Sarah Whitfield from the Bioethics Department at the University of New Haven. Today, I want to address a critical and emerging topic in the field of healthcare, the ethical implications of genetic testing and personalized medicine. With the increasing availability and sophistication of genetic tests, we now have the ability to predict, diagnose, and even prevent a range of medical conditions before symptoms appear. But this also raises some complex ethical issues that we are still grappling with as a society. I hope that by the end of today's discussion, we'll have a clearer understanding of the potential benefits and challenges involved in these advancements. So, what is genetic testing? It involves analyzing a person's DNA to look for genetic variations that may increase the risk of certain diseases or conditions. This can lead to personalized medicine, where treatments are tailored to an individual's genetic profile, potentially offering more effective and targeted therapies. This technology promises to revolutionize the way we approach healthcare, especially in fields like oncology, cardiology, and rare genetic disorders. However, as with any medical breakthrough, there are ethical concerns that we must address. One of the most significant issues is privacy. When individuals undergo genetic testing, the data collected is incredibly personal and sensitive. Unlike most medical information, genetic data doesn't just reveal information about the individual being tested, but also about their biological relatives. Who should have access to this data? Should employers or insurance companies be able to use it to make decisions about hiring or coverage? We already see some legal frameworks in place, such as the Genetic Information Non-Discrimination Act in the US, which prohibits discrimination based on genetic information in employment and health insurance. But even with such regulations, concerns about privacy remain, particularly in terms of who has the right to access and share this data. Another issue is informed consent. Genetic testing often reveals complex information that can be difficult to understand. How do we ensure that individuals are making fully informed decisions about undergoing testing, especially when the results can have far-reaching consequences for themselves and their families? It's not enough to just provide someone with a document to sign. Healthcare providers need to ensure that patients truly understand what their genetic data might reveal and the potential emotional and social implications. And then there's the question of equity. Genetic testing and personalized medicine tend to be expensive, and not everyone has equal access to these cutting-edge technologies. This raises concerns about fairness in healthcare.
Are we creating a system where only the wealthy can afford the best treatments while others are left behind? Personalized medicine has the potential to deepen the divide between different socioeconomic groups, and this is something we must carefully consider. How do we ensure that all patients, regardless of their financial situation, can benefit from these advancements? A recent study highlighted some of these issues. It showed that while genetic testing is becoming more widely available, individuals from lower income backgrounds are significantly less likely to undergo testing, often due to cost or lack of access to specialists who can interpret the results. This not only limits their access to personalized treatments, but can also increase health disparities in the long term. It's clear that access to genetic testing must be addressed if we want to avoid a two-tiered system in healthcare. Moreover, there are concerns about the psychological impact of genetic testing. Finding out you have a predisposition to a serious illness, such as Alzheimer's or cancer, can cause significant anxiety. Even if you never develop the condition, how do we support individuals emotionally as they navigate this new information? Are we prepared to provide adequate mental health support for patients who may struggle with the results of their tests? There are also ethical concerns about the potential for misuse of genetic data. Could we see a future where genetic testing is used to design babies, or where certain traits are selected over others? These concerns, while still largely hypothetical, are already beginning to surface as we look at how genetic information can be applied. In conclusion, while genetic testing and personalized medicine hold enormous promise, we must navigate the ethical challenges they present carefully. Privacy, informed consent, equity, psychological support, and the potential for misuse are all issues that require thoughtful consideration. I believe we can develop policies that promote the responsible use of these technologies, ensuring that everyone can benefit from them without compromising ethical standards. But the conversation must continue, and solutions must be proactive, not reactive. Extract 2. Questions 37 to 42. You hear Dr. Emily Carter explaining the importance of interprofessional communication workshops. Now, read the questions. You now have 90 seconds to read questions.
Good morning, everyone. I'm Dr. Emily Carter, and today I'll be discussing the importance and effectiveness of interprofessional communication workshops in healthcare. What these workshops do is help healthcare professionals from various disciplines collaborate more effectively, especially when it comes to handling complex and sometimes sensitive discussions about patient care. The reality is that healthcare today is rarely a solo endeavor. More often than not, doctors, nurses, pharmacists, and other allied health professionals need to work together. And effective communication between them can be the difference between a patient thriving or experiencing complications. Despite the critical role of teamwork in healthcare, communication failures between professionals are surprisingly common. These breakdowns can result in treatment delays, medical errors, and even harm to the patient. Yet many clinicians report that they haven't received formal training on how to communicate effectively with other members of the healthcare team. Interprofessional communication workshops are designed to fill this gap. They offer structured learning experiences where healthcare providers can develop and refine their communication skills in a safe and supportive environment. During these workshops, clinicians from different backgrounds come together to practice handling difficult conversations, clarifying roles and responsibilities, and navigating conflicts that can arise when working in high-stakes environments like hospitals. But why do we need these workshops? Well, one reason is that many healthcare providers feel burdened when dealing with complex cases because they're not always sure how to approach delicate conversations. Whether it's explaining treatment plans to colleagues from different disciplines or talking to patients about difficult diagnoses. Another reason is that healthcare delivery is increasingly moving towards a team-based model. This model requires clear and open lines of communication, but achieving that level of collaboration doesn't happen naturally. In fact, studies have shown that poor interprofessional communication is a leading cause of medical errors. So, training that focuses on improving these skills is not only beneficial, but essential. Our team recently conducted a study where we implemented a series of interprofessional communication workshops across several hospital departments. In these workshops, clinicians participated in role-playing exercises where they practiced communicating during various medical scenarios. Some scenarios involved high-pressure situations like critical care, while others focused on everyday interactions that could easily escalate into miscommunication without proper handling. The goal was to give participants a chance to practice speaking clearly, listening attentively, and recognizing when they needed to slow down and ensure their message was fully understood by everyone involved. What were the outcomes of this study? Well, before I get to that, let me give you some context. We surveyed participants before and after the workshops to assess their confidence in handling interprofessional communications. Prior to the training, many of the clinicians reported feeling unprepared for conversations with colleagues from different disciplines, particularly when the discussion involved conflicting viewpoints or complicated medical jargon. However, after the workshops, there was a noticeable improvement. Nearly 80% of participants felt more confident in initiating conversations with their peers, and they reported feeling more equipped to manage disagreements that might arise during patient care. One thing that stood out to us was how the workshops improved not only communication skills, but also self-awareness. When you're in the middle of a busy day, it's easy to forget that communication isn't just about what you say, but how you say it. Many participants commented that the workshops helped them become more mindful of their tone of voice, body language, and even the timing of their messages. For example, some realized they were rushing through explanations because they were worried about time, but that only left their colleagues confused and frustrated. By slowing down and paying attention to their delivery, they were able to create a more collaborative atmosphere. So, how does this impact patient care? The most immediate effect we saw was a reduction in the number of communication-related errors. Departments that implemented the workshop saw fewer instances of miscommunication, leading to treatment delays or confusion over patient care plans. But beyond that, improved communication between healthcare professionals created a more positive work environment. When clinicians feel heard and understood, they're less stressed and more focused, which ultimately benefits the patient. Looking at the broader picture, if we continue to implement these workshops across the healthcare system, we could see significant improvements in both patient outcomes and clinician well-being. Improved communication not only reduces errors, but also fosters a culture of respect and collaboration. So to sum up, interprofessional communication workshops are an invaluable tool in modern healthcare. They help clinicians navigate complex discussions, enhance self-awareness, and ultimately improve the quality of patient care. Thank you for your time, and I hope you'll consider how these workshops can benefit your practice.
That is the end of Part C. You now have 2 minutes to check your answers.